Let's react to this video by Delidiary called I Got Botched by Botox.
Basically, as you can tell from the title, I have sadly been botched. Thank goodness it is hopefully temporary because it's botched via Botox, which is meant to wear off.
Yeah, whether the Botox injections go great, you're gonna get improvement for about 3 months on average, or if it's the worst experience ever and muscles get paralyzed that were never meant to be paralyzed, it still will usually last for about 3 months, and then you can move on to a different provider or never inject that area again, whatever you choose to do. But that's both the good and the bad of Botox, or any other neurotoxin for that matter. Keep in mind there are some neurotoxins these days that can last longer, like up to 6 months even, which can be a good or a bad thing, depending on whether you love the actual outcome of your result or not.
And I will show you what it looks like in just a sec. But the reason why this has happened is because I went to get masseter Botox to my jaw, which is to stop jaw clenching, because I cracked a tooth from jaw clenching during my sleep, and my dentist said you should go get masseter Botox as an option.
Yeah, so first line is going to be a bite block when you have that kind of clenching or that bruxism that exists in the middle of the night that people can't really control. You know, sometimes it might be from built up stress, and sometimes it's just like the way people are anatomically configured and the way that they, sleep, they clench that jaw and then they wake up and they have a lot of pain. And some people can get so much wear and tear on their TMJ joint that they sometimes need to get the entire joint replaced, which is very problematic and a difficult surgery to do. So it's better not to get yourself into that type of trouble in the first place. The first line prevention is going to be a bite block that's going to sit in your mouth and prevent your teeth from grinding against each other, right? So that's always the first line. And if that doesn't work, some people end up considering Botox injections to that masseter muscle to essentially cause weakness of that muscle, atrophy of that muscle that will impart less of that biting and that clenching that occurs during nighttime.
So I went to a doctor, a GP, who is also certified in doing Botox, and I went there with 3 recommendations. He had good reviews.
You know, these days everyone is doing Botox, and there are certain areas that are a lot more tricky to inject compared to others. So areas like the forehead or the glabella, are not the most challenging areas to inject. Of course, they have their own nuances, but they're a bit more forgiving than something like the masseter area, where that muscle is generally deeper. It has multiple heads to the muscle that you have to inject in order to properly paralyze that muscle. It also is an area that has lots of other important muscles in the vicinity, muscles that control our ability to smile, to eat, to properly animate. So because of that, this is a trickier area that really should be performed by someone that has, as much experience as possible with Botox and with facial anatomy.
It was all official and legit, and he injected the wrong muscle. He's injected my smile muscle, which I think is called the risorius.
Yeah, so unfortunately, this is a fairly common complication when Botox into the masseters is not performed properly. And this is very much a technical error almost every time. The reason is just understanding the basic anatomy to that area. That really tends to keep you safe from this type of complication. And the tricky thing is, you're looking at this diagram here, but the issue is that when you're injecting, you're not seeing these muscles, right? You're seeing skin, you're maybe feeling for the muscles if you even know kind of where they are, and you're not seeing this, right? You're not seeing these actual muscle fibers. So you need to really understand where the deeper anatomy is based on surface landmarks. And if you've, never seen it surgically, if you've never, gone to all the courses that are required to really understand this, it can be difficult for, some folks to grasp. And when you're not sure exactly where the masseter starts and ends, how do you know where the other muscles are, right? So the risorius is going to be on the medial edge, or the part closer to the center of the face of the masseter muscle. So if your injection is too close to that anterior border or the medial border of the muscle, you run the risk of getting some of that neurotoxin to spread into neighboring muscles, namely the risorius, that can give you what I'm sure this lady is going to be showing you that she had as a complication. The trick with masseter Botox is to stay more lateral, or more to the posterior end of that muscle, or into the heart of that muscle, like the central portion, rather than too far towards the middle of the face.
And I know that it's the wrong muscle because I can't smile properly now. And my masseter can still clench to the full degree it always has. So the dude missed. So for those of you guys who don't know, this is what I looked like previously when smiling, and this is what I look like now. So I basically have a downturned smile because I can't smile. So in video form, like the more I try and smile, the more stank face I get. So this is me trying to give you guys like a really big smile. And it is so sad not being able to smile. It's very confronting. I'm trying to like laugh and smile. If I do a little one, it kind of gives me this like unsure smile.
And it looks like they were treating both sides, right? So both masseters, because she has a very similar effect on one side, compared to the other. So that's the thing, I know she looked at the reviews for, the physician and, everything seemed fine. But, it's very important to understand how many procedures of the specific type that you're going in for that person does on a regular basis. So if they inject Botox all the time, you got to ask, like, are you injecting the forehead all the time? Are you injecting the masseter all the time? Like, that matters, because if it's something that they're not doing often or they don't have a ton of experience in that specific region of injection, they may not know the proper anatomy of that area, and then you can end up with these types of complications, right? So in just general advice for people looking for the proper aesthetic provider for them, it's really a critical element. They can have great reviews, they can be a really nice person, the prices could be fair, but are they doing enough of the specific procedure that you're interested in? And, enough can be somewhat subjective, but in my opinion, for most aesthetic procedures, you should be doing it, for the most part, at least weekly if you want to be kind of really, really good at a certain type of procedure. So that is something that you kind of want to ask for. And ideally, they're doing it at least weekly.
I think if I wasn't going through this experience and someone else was, I would be like, oh, it's temporary. Like, you can move on from this. It won't be for very long. It's not like it's permanent or anything. But I am shocked about how this has psychologically impacted me.
Well, yeah, especially when, you're used to making videos. So like in her case, if she's on screen all the time and you can't fully animate, I mean, that can be really problematic for just expressing your emotions and just interacting with people. That's really tough. I know that I had a string of videos where I had a cold sore on my lip and like, I didn't love it, but I kept making videos. But like, you're always kind of like, oh, are people going to say something? Are they going to worry? Like, are they going to like wonder like what that is and what caused it and all these types of questions that some people, end up kind of asking, right? So yeah, I get it. I get why this was so tough for her, even though, yeah, realistically, within a few months, the facial animation will start to return, hopefully back to normal.
At first, I thought it was hilarious and sent videos to everyone and like put my face next to Wallace and Gromit, which is funny. It is funny. But then I kind of think I went into a bit of shock as it sunk in that I was going to be stuck like this for maybe 4 to 6 months, and then realizing I am on camera for a living and that I like don't feel comfortable filming like.
Yeah, the other thing is that the dose that's delivered for the masseters can be quite high. So if you hit the wrong muscle with a very high dose, that of course can be, even more, potentially long lasting and traumatizing for the person.
Actually also has a terrible sensation. Like it feels like my whole face is being pulled down. And although I don't think it's affecting my speech too much, I can feel, and it does feel a little bit hard to talk. So, and the other thing is, like, I think you can tell a little bit, but the other thing is I'm only on day 9 and this is going to take 2 weeks. So another 5 days before it reaches its peak strength. So in other words, it's only going to get worse.
Yeah, with Botox, it usually takes about 14 days for you to see the maximum effect of the injection that you had. So yeah, she's right. I mean, it's going to be another few days until it's kind of maxed out. And then she's going to ride that out for months. So it's just something she'll have to get used to temporarily.
And every day it's a little bit harder to talk. It's a little bit harder to smile. And I feel more and more restricted. So I'm a little bit nervous to see how I go over the next few days. And also, although it's not obvious to you guys, hopefully, my entire lower face is also being brought down.
And in 2021, BuzzFeed actually interviewed me about a similar complication that happened to a woman who was posting on TikTok. And the exact same thing happened to her smile from actually Dysport injections to the masseter muscle. And Dysport has a higher propensity to spread compared to Botox. So when I used to inject the masseter muscles with neurotoxin, my preference was for Botox rather than Dysport because I felt like it was more likely to stay in a more confined area. And that served me well for the years that I did these types of injections.
So my jowls are brought down more than they usually are. My cheeks are hollowing out more than they usually do. And when I rest my face, it's like this. It's like the freaking blobfish. Like, I'm not doing a face. You can see my bottom teeth, and that's not my normal resting face. So, like, it will wear off, but by the time it wears off, because there's no way to dissolve it, Botox, it just wears off over time. But because other muscles compensate for the muscles that have been frozen by the Botox or relaxed by the Botox, when you get your other muscles back working again, there could have been changes to the face.
Yeah, but it's highly unlikely that these changes would be permanent in any way. So it's one of those things where you just have to be patient and you have to kind of think positive throughout the experience. And it's not easy, but she'll get through it. And she shouldn't then have any long-term sequelae of this Botox complication.
I'm like afraid of it not going back up again, which there is corrective work for that, but obviously I don't want to have to do that.
Yeah, I mean, this isn't the time, to run to any like non-surgical tightening type of treatment or, God forbid, go and get a facelift because you're worried about this type of droop. This is a more temporary process that will correct itself. And it's important for surgeons actually to ask about these types of injections because if someone comes in, doesn't mention that they had, say, Botox and masseters a few months ago or a month ago, and then you go in and you start planning a whole, facelift surgery, especially as younger people are getting these facelift surgeries, that can be the wrong, treatment. And that can be quite costly for the patient and also for the surgeon if things, don't go exactly according to plan.
It's been a pretty awful experience, but I will say I never thought this would have such a psychological impact on me as it has. It was like being dumped. And even looking at myself in the camera, just this whole drawing down thing.
Yeah, because some people are actually going in for masseter injections because they're trying to slim their face. Some people are not even doing it for the TMJ, benefits that you can get. Some are doing it for both. It's kind of like rhinoplasty surgery where some people get it just because they don't like a hump on their nose or the width of their tip. And other people get it because there's like a functional problem, like they can't breathe through one side of their nose. And then other people get it for both those reasons. So the same type of scenario holds true for masseter injections with neurotoxin, where you can have just a cosmetic reason because you don't like how strong the masseter muscle is and you're looking to thin out the bottom of the face, or you're looking for a more functional type of improvement so that you're not clenching as much, like I think she was kind of going for, or it might be for both reasons, right? And that's okay too.
Even though you guys probably don't think it's that bad, I'm just like, oh my God. And you always notice things more yourself than other people. Like, I just can't stand to look at myself at the moment. Like, I don't want to look in the mirror. I don't want to look at myself on camera. And then I'm always constantly going like this because it feels weird and my mouth feels half numb. It's just an awful, awful feeling. But thank goodness there's no pain because I've heard other people this has happened to. They actually have pain as well. So a lot of you guys have been saying, well, you need to sue them. Sue this doctor.
Well, I'm curious to hear what she has to say, but what I have to say is that, procedures come with risks, right? And if you can prove that there was like complete negligence, like the person had, absolutely no idea what they were doing, they weren't properly trained to do these procedures, they never explained any risks associated with the procedures, I mean, then maybe you can have a case, but usually you also have to show that like there's like long-standing, problems from the procedure, not just like it's going to go away in a few months and you'll be fine, right? So that typically won't win you a case, from a patient's perspective. But remember, with any cosmetic procedure or any type of surgery or aesthetic procedure, anything at all, there's always going to be the potential for complications. And this is a very real one when it comes to injecting the masseter muscle with Botox. Even in the best of hands, it's possible to get this type of side effect or complication, whatever you want to call it. So suing for something like this is unlikely to, win you a ton of money, right? It just isn't likely going to do that. But yeah, people are very quick to jump to that. I think sometimes just talking to the clinic, keeping in close touch, explaining the situation to them, explaining how you feel, seeing how they are able to deal with it, seeing how caring, they are or are not, should also influence your decision before you just jump to like suing. I mean, suing is a big process. It's a big deal. It's a big deal for the patient to kind of undergo financially and just, psychologically. And it's a big deal for the doctor and the clinic. Most people are not out there trying to hurt people, right? They're out there trying to help. So, unfortunately, complications occur. And you would hope that there was like an open line of communication with the patient and a willingness for the clinic to help as much as they can. Sometimes the answer is just waiting and giving it time, seeing how things change, supporting the patient as best they can. But just jumping to I'm going to sue you is typically not the best way to deal with things from either, kind of angle or from either perspective of doctor or patient. So yeah, so I think, people online are very quick to just be like, yeah, sue them. But it's not the best way to handle things almost ever. But of course, there are exceptions.
One, I signed a waiver. Before you get Botox in Australia, there's always a waiver you sign basically saying if anything goes wrong.
Yeah, in the US, same thing. You have to sign a consent, and usually it tells you a million risks, right? And people read those risks, and some people don't read those risks, and others read it, don't really get it, or they don't fully process what it could be, or they may not even really know that something like this is possible. But yeah, I mean, you usually sign off on a lot of things when you're signing those forms.
If anything goes wrong, you can't sue them.
In the US, you could sue anyone for anything. So I don't know how it works in Australia, but, the consent forms won't save you from a lawsuit in this country.
If you are going to do this, there are always going to be risks. And although I don't believe this is very common, I was the unlucky one. Like I said, I went to a certified place. I went to a GP, for goodness sakes. So that's the first thing. Second of all, to actually sue someone in Australia is really expensive. 3, mistakes happen. I don't think this person went in wanting to mess up my face. Honestly, they probably feel mortified and bad about it if they're a decent person.
Yeah, I mean, anyone who does procedures frequently is going to have these different types of complications. And I can tell you from experience, I mean, I always feel terrible when something happens with whether it's an infection or a little nerve injury or, anything. Even if the patient's unhappy and I know that nothing wrong, occurred and nothing bad happened, but they're just unhappy with their result. I mean, yeah, I feel terrible. I mean, it's like, even if objectively it's a nice result, but for whatever reason they're still unhappy, like, it's not a good feeling, because I don't know, from personal experience, I mean, I care, right? Whether I like it or not, I mean, it's just kind of in my, I think, DNA to care. When you care, you want people to have good results objectively, and then you want them to be happy with the result, because a good result, in a picture, but an unhappy patient is not the end goal here. You always shoot for like the best possible outcome for the patient and for them to be happy. So when that's not the case, yeah, it feels terrible. I think anything with like a very human type of interaction, such as doctoring, the emotions can run really high or really low. I mean, I try to stay even keel, but it can be tough, and sometimes, I mean, most of the time when people come in, to my clinic for after surgery, after they've recovered, months have passed, they're generally very happy, and so that's awesome. But I try not to kind of get too elated and too like, oh my god, everything's amazing, because maybe later in the day I'll have a patient express concerns about something, and then you kind of get down on yourself. Oh, like they're not totally happy with this, how's that going to turn out? So trying to kind of stay a little bit more balanced has been, I think, at least my approach in my clinical practice.
That's the other thing. Like, I don't want to destroy someone when we all do make mistakes. I'm never going back to them. I'll make that very clear, and I will never suggest anyone goes there. But I'm not going to destroy them financially or their business. It's done. What have they said to you? So like I said, we're up to day 7 today. I had it done last week, and I did call up the day after I realized this was happening. Oh God, I can't look at it. Just not going to look there. That's my monitor. And they were like, this doctor's actually on holiday. He will be back next week and he would like you to come in. And I said, I do not want to come in. Please just give me a refund.
Well, this is also tricky because the doctor wants to see, they want to confirm that what you're saying is true and that maybe there is something that, they're missing through just a phone call. You can do also like a video call and see the result. You don't necessarily need to see, the person in the office, but, some doctors are not as equipped for like video visits and all of that. So I think it's very reasonable for the doctor to be like, look, I'm away right now, but like as soon as I'm back, I want to see, this patient and really confirm things and talk to them. I get that she had this complication. I get that she wants her money back, but I don't think it's unreasonable to go back to the office and talk to them and again, see how they deal with it on like a very human level. And then of course, it would be fair also to request the money back. That I understand. But from the physician's perspective, I mean, wanting to see your patient back in the office is like, I think that's a commendable thing. I think it would have been worse if he said, hell with that person, take your money back and go somewhere else. So it sounds like they handled the kind of the post-complication scenario well so far.
They spoke to him while he's on holiday, and then they got back to me and they're like, look, we're really sorry, but it's the protocol that we have that he has to see what's happened in order for you to get a refund. And I was like, oh, I don't want to go in. The reason why I don't want to go in is because I don't want to relive the trauma, of going in. I don't want them like looking at my face, pointing out what's gone wrong. Like, I don't want to experience anything to do with this anymore. I think my biggest fear is I'm going to go in, they're going to be like, oh, we don't know how this happened. And we're not, mistakes happen. You signed a waiver. We can't give you a refund.
Yeah, I mean, I guess, she can worry about that, but there's other ways of, kind of taking her frustration out. If she feels like she deserves her money back and they're not willing to give any money back, I mean, usually the patient will go and maybe then write a bad review or, whatever it might be. But like, you have some sort of recourse still, just not showing up to the office when they asked you to go to the office. Maybe you're not reliving the trauma. I understand that, but you're also kind of like not trying to work with them to figure out, the next step and the resolution. It's a two-way street. They're trying to understand exactly what happened and sort through that. And maybe they'll say, hey, we still don't know what happened. It could be that they don't know about the risorius muscle, right? Maybe they don't really understand, what went wrong, but I think it's fair to go back in to let them see, evaluate, and then still for her to request that they refund her because she's not happy with her experience and because she has to kind of deal with this now. So both can be true here.
Oh, and we also have to charge you for this appointment. That's my fear.
Well, I mean, charging her for this kind of follow-up appointment, I think is very unlikely and something she can ask them. Are you asking me to come in and then are you going to charge me for that visit? Because, I mean, that would be preposterous. And I highly doubt that any office in the world would charge someone for just a post-op visit after something like this happened. I don't think they were planning on doing that.
But I'm hoping that it goes well. And what I would really love is them to say, sorry, we messed up, we missed the muscle, we feel terrible about this, it is not at all the experience we want people to have coming to our clinic. We will give you a refund and you will not be charged for today.
Listen, I think that would be a very appropriate response, from the clinic. I think that's a very fair ask from her perspective. And it sounds like she's planning on going in to see them. So I wonder if she does and if there's an update. We'll see.
That's what I would like from the appointment. So I'm going to check back with you guys after I've been and let you know how it goes. Because today is Thursday and I'm going on Monday morning as soon as he is back. And I guess, it's better that this guy wants to see me instead of doing the same thing like, oh, I don't want to see her because I made a mistake and I don't want to own up to it.
Yes, exactly. That's what I was getting at.
That's at least a good sign. As much as I hate the idea of going in, it probably is the right thing for them to do, like see me in person and see what's happened. All right, you guys, welcome back to now week 3. At the 2-week mark, I went to see my doctor and I was really hoping it would go well. I had hoped that I'd get a refund and an apology. The good news is I did get a refund, yes, of my full $500. Actually, technically, if we're going to be petty, I'd paid $507 and they gave me $500 back. Not exactly precise, but whatever. So I got that, which is good. And then I also did get a very cold, brief apology. So that's good. I did get what I wanted, but the process was not nice. This doctor did not deal with it well. And it was actually kind of crazy because I feel like he used every method he could to try and not take any accountability. And it makes me think this guy has done it before. But anyway, let's talk about the consult. So as I said, I had to go in and see him. I wasn't looking forward to it, but I was kind of hoping that maybe this was a really good thing, that he was going to take accountability and like say, I'm really sorry about this. This is not how we want our patients to walk away feeling. Unfortunately, there are risks and mistakes can happen, and I'm very sorry. But no, he tried to not take any responsibility for it. He basically tried to make me feel like I was crazy.
Oh, it's not good. That's not good. Yeah, I mean, that's like, I think, doctoring 101. I mean, you have to first own up to what's in front of you, you know? I mean, it's, it's good to take preoperative photos and sometimes even a video, even when you're just doing kind of Botox and filler and, it seems very, repetitive and it's not like major surgery. But, I think it's good for practitioners to get into the habit of taking, good videos and photos and, really documenting how things look before the procedure so that afterwards you have something to compare to. Because I can tell you in my experience, especially when it comes to the lip surgery that I do, some people will say, months went by after surgery and they say, oh, my nostrils, I don't know, they look so different. And we look back at the preoperative photos and it looks like very similar, as if nothing's really changed as far as the nostrils. But at least you have something to like objective that you can sit down, look at photos with your patient and just be honest with what's going on. Yeah, maybe the nostrils changed and maybe it was because of surgery, but maybe there was no change and maybe they just forgot kind of how things looked beforehand. But I've seen both scenarios play out, many times. So with this situation, if the doctor had photos and like a video of her dynamically moving her face and had that to compare to, then I mean, it's very little I think he could say if it's like, okay, yeah, clearly the smile is different. We changed something about you that wasn't really the intended goal of the procedure. Let's maybe figure out why that happened, blah, blah, blah. But if you have nothing objective to start with in the clinic, it can be kind of tricky, and maybe it gives the doctor the ability and sometimes the patient the ability to make a lot of different claims that may or may not be true. But when you have something objective, both parties can really see that for a fact of like, this is where we started, this is where we ended. So I think that type of documentation is important, especially for sorting out these types of different scenarios post-procedure or post-operatively. But yeah, once you do see that, hey, something is objectively different and not in the best of ways, I think it's important to then be honest with the patient about like, you see that, you see what they see. I think that's, kind of mission number one. And then it's about trying to figure out like, why did that happen? And sometimes there's a very clear answer and sometimes it's not so clear. And it's just like, look, I'm not sure exactly what happened. And then it's like, well, if you don't know what happened, if it's not a common complication or you've never seen it before, then you say, hey, I'm going to ask a colleague. I'm going to talk to, some friends, some colleagues, and let's see what others say, and I'll come back to you. That's what I do. I mean, it's very rare these days for me to see something new that I haven't seen before, but if that occurs, that's then how I proceed. And then, thirdly, then you have to figure out, well, what are you going to do about it? And sometimes it's, well, look, in this case for her, it's like, okay, we got to let the Botox wear off, and then we can do another injection. But if you don't trust me anymore, you don't want me to do another injection, then, I don't want you to be unhappy, so let me do some form of a refund, whatever. But that's really the proper way to stage it. And what I always recommend for patients, and I know it could be tough because the doctors are not all the same and some are kind of rude and whatever, but if someone seems like, reasonable and they have a good reputation, for the patient, what I always recommend is confront the situation with like an open mind, with kindness, with respect. Don't just come in guns blazing. Oh, you messed me up. You owe me this. That is a good way to get the doctor, and the doctor seemed to be quite defensive and not want to really deal with you. And I mean, it's just kind of human nature. But if you approach things with like overall respect and, kindness, I think you'll probably get something similar in return. And if you're not getting it, well, then you can kind of amplify your intensity a little bit. But that, I think, is a good way to at least start off. And I'm sure she did that with the clinic where, she had this procedure.
He said, "Oh, I've been told you think you've been botched," like as if I'm crazy to think that. And I was like, yeah, I emailed you pictures before and after. And he was like, yeah, and I've heard you've been to other practitioners, or you probably Googled it yourself. And I really didn't like that he was obviously trying to belittle me or make me feel stupid. And I was like, yes, I did speak to another physician, and they said that you mistakenly injected the wrong muscle. And he was like, okay, well, it's impossible to inject another muscle because there's no other muscles there. And I was like, what?
Wow, that's a scary response that she got back. Yeah, I mean, clearly what I'm hearing from this story is that this provider maybe just didn't have the proper training background to be doing these specific types of Botox injections. It seems to me like it was maybe just kind of from that lack of knowledge and experience that he just maybe wasn't aware that this was possible, which is scary and unfortunate.
Anyway, he then moved on and said, let me feel. So he felt here, didn't make any comment because he probably thought, okay, she can still bite fully. So he obviously knows he messed up, but he just ignored that. And then he started taking before and after photos. He took after photos because he already had before photos from the week before when I went in.
Oh, okay, so that goes back to my previous points, that it's good to keep these kind of before photos and videos because, you need something to compare to. So it seems like they already had that, and now he was taking the afters. Okay.
But the thing is, he didn't take any smiling photos. So he compared my resting face with my new resting face, even though the big problem is my smile. And he's like, do you see any differences? Do you see anything different? I was like, I mean, a little bit, yeah. And he's like, where? Point it out.
Yeah, remember that with Botox, you're paralyzing muscle, and muscle mainly works, dynamically. Like, when it's actually contracting, that's what leads to different movements, right? So comparing things just in a static type of fashion is not too useful when it comes to, assessing the masseter muscles or really any other muscles that you're, injecting on the face. So capturing dynamic movement is very important, so she's right.
And then he said, the thing is, depending on like a person's face shape, sometimes they don't get the result they want. And for you, it's not the smile you want, and that's okay. It just didn't work out for you.
Well, she never asked for a different smile, so it's not like he was trying to tweak her smile. What kind of response she got there? That was a little bit odd.
And then he starts saying that he does this procedure on some of the girls that work for him. And he's like, I do 4 girls here at the clinic. 3 of them love the outcome. One of them, she kind of smiled like this, and she didn't like it so much.
Yeah, with masseter Botox injections, you shouldn't be getting any alteration of smile. So, he's clearly injecting, like we talked about previously, too far medial, right? So the injection should be almost lining up with the sideburns, if I have sideburn hair, but you get the idea. Usually aligning the injection points with the sideburn is a good general reference point. So if the marks that they made or the actual, injection points were too far towards the middle of the face, like if they were out here, of course you're going to hit some of the other muscles in the area.
And you know what? She's an influencer. She's got 56,000 followers on Instagram and started telling me about how she's an influencer. I'm like, why is this even relevant?
Irrelevant.
And also it kind of sounds like you botched her too if she couldn't smile properly, to be honest. And yeah, he was just like, it just didn't work for you. I was like, no, I can't smile. It's downturned. This is not normal. And then he said, it's impossible for him to inject the wrong muscle.
Yeah, clearly, he was gaslighting her, and that's never a good feeling.
Anyway, so I guess The lesson from this story is that it's really important to advocate for yourself. Even if there's a doctor who is meant to look after you and you are meant to be able to trust them and believe everything they say, sometimes, unfortunately, that's not the case. So always get a second opinion or a third opinion and just know in your gut what makes sense.
Yeah, remember though, with the second and third opinions, I mean, I'm all for that as well. But what happens in the aesthetics community sometimes is that people want to badmouth, other people so that they get the business, right? There's like financial incentives sometimes for folks. So you have to be careful who you're going to for those second and third opinions, and really just doing the proper research in advance to pick people who have a lot of experience, like I said in the beginning, with that specific procedure or surgery that you're hoping to get. That's really what's going to give you the best peace of mind and the best potential for a great outcome with the lowest risk of complications. It doesn't mean it's going to bring the complication risk down to zero, but you're going to minimize it by going to a place that's doing that procedure over and over again, and where you should also ask to see the results, see their prior work. And if they're generating nice results and they overall have nice reviews and they're doing it all the time, you're likely going to do pretty well. I mean, is it going to be the perfect outcome for you? Nothing's ever perfect, but is it going to be something that significantly helps and addresses the concerns that you had? Most likely. But also, those clinics will come at a slightly higher price point, right, than some others. So I think being willing to spend a little bit more for quality when it comes to these types of procedures is important, and it's something to keep in mind. But of course, you can spend a lot and still end up with a bad result. So yeah, it's tough from a consumer standpoint, but I hope that she's able to find someone that she can trust and that the next time around she gets an awesome outcome.